Hello, my name is Rhea from Active Health Clinic. You may already know that, you may have seen me before. But today I wanted to talk a little bit about a somewhat controversial topic, being exercise. Now, at the clinic and me personally, we prefer not to use the term exercise and more movement, movement capacity, movement baseline, movement management, because we move every day, whether that be lifting a cup to our mouth or whether that be going to the bathroom and beyond. But we have movement in every single day. And it's really important that we are aware of our movement, what movement is movement that we need, what movement is helpful, and what movement is a trigger or a challenge or outside of our baseline. So movement can be positive or negative, and it is really dependent on the context for that person and their personal circumstances, for that person's diagnoses as well, and all of the factors that go into diagnoses and symptoms and medications, etc. But it is really important to respect that we do each move. That might be minimal movements if we are lower capacity, or that might actually be exercise for other people. But what's really important first and foremost is safe movement within our capacity and safe movement within our symptoms. Now, for some people, you may have been told that movement would be good for you, whether that be you're an OI POTS patient that needs to strengthen their lower limbs to help with circulation throughout their body. You might be someone who has hypermobility, which has been told you need very specific movement to help your body manage activities of daily living a bit better. You might be someone who has chronic pain that's been told to do this or that to help with chronic pain management. So there are many conditions that movement is safe if it's done correctly, or movement is actually prescribed to you. Now, what today's video is about is making sure that you're moving safely for your needs, your capacity, your diagnosis, your circumstances. So first and foremost, you really need to make sure that you're aware of your baseline and your overall baseline, considerate of your physical baseline, your cognitive baseline, emotional, environmental, etc. Because you need to be aware of where your energy is going or your capacity is going, and where you are stabilized versus where you are booming and busting. Because if you are booming and busting, and putting movement in that can actually lead to further booming and busting. Or on the flip of that, for some people, putting movement in can help them with some green time or some downtime and actually recharge. So it's really important to see where you sit in your overall baseline and where you sit within your movement capacity as well. But what's important also in this is understanding that movement is different from person to person. Sometimes this is sitting upright in bed. Sometimes this is going to the other bathroom rather than the one located closer to you, so there's just slightly more steps involved. For some people, it's actually getting outside in their garden and watering their plants. For others, it is going for a walk or doing some gentle strength training or proprioception training for those with hypermobility. It can also be gentle stretches for those with chronic pain. There are many, many different types of movement, and it's really important to find the movement that is medicine to you. It's really important not to look at the blanket rule of exercise. I need to be exercising or I shouldn't be exercising, because that's actually not realistic. It's not reality for those with a chronic illness. It's actually exploring what is safe. And it isn't the same thing, may not be safe every day for you. For some people, absolutely, definitely. For others, maybe not. And it's really important to explore that. And for me personally, I've recently had a baby, and exercise after that was not an option. So I really had to learn what was good for me. There was times that my body was really, really in pain and uncomfortable because I hadn't been moving. So in that scenario, I just did a couple things around the house, and in certain circumstances, I did a couple gentle stretches, but I just moved my body based on what I was feeling like. Then other days I felt like I needed to move and get out of the house, so I'd go for a few minutes of a walk, 3-4 minutes type thing. Other times I felt like I needed to connect with it a little bit formally, so I added in some gentle stretches that was kind of yoga-like, not too much. And then, a few months down the track, I started to reconnect with some gentle strength and those elements. But there was other times it was just like, I just need to sit in this position for a little while, or I need to go out and sit in here, or I need to stand up at the bench rather than sitting at the stool because I need to be upright. So my point is that we have movement that we crave, that we we'll either get ourselves in or start to think that that's maybe what we want to do. And what I'm encouraging is for you to follow that. And obviously with consciousness of how you're already feeling and what you've done that day in your baseline. But it's really important to trust that there is some movement that your body will need sometimes, and to be accommodating of your symptoms, and to listen to what movement is safe that day or what movement is maybe not a good idea. And this is why exercise is not always suggested for people with this population, because it implies a routine, it implies a workout, it implies a prescription of this exercise, this reps, this sets, etc. And in a lot of circumstances, that's not appropriate. And it's really important to acknowledge that and go, okay, well, what is appropriate? What is safe? What is accessible? And what helps me manage symptoms, or what helps me stabilize my condition, or what helps me recondition so that I'm able to build strength or endurance or stamina, which in turn will help with some of my incidental activity. So this is not a video to say you should or you shouldn't be doing movement or exercise or anything like that, but it's to explore that. Again, listening to your body. Listen to your body. If it's telling you not to do movement that day, then don't. Or maybe do gentle movement in a more incidental way. If it's telling you that it feels like it needs to move, then listen to that and go tread with caution. Just go gently into it. Tip those toes into the water and see how it feels. Review and see what you can do the following day. It's not about big chaotic movements of booming and busting and doing this and making it, doing too much and it not working. It's really about letting your body be the guide in terms of what's accessible to you that day, that week, and also what's important to you. It's not about doing it for the sake of doing it, but it's making sure that if it's something you want to do, that you have access to it in a modified way that is safe for you. So point of this video is for you to just kind of review how you're going about your movement, either incidentally or purposeful movement, making sure that you're checking with your symptoms in doing so, that you're respecting what your symptoms have to say, using that as your guide within your baseline, using all of the other things within your baseline as a guide to understand, are you stable, or are you booming and busting, or are you teetering on an edge and need to go to rest rather than something else, but making sure that you're checking in with your body and its needs, and trusting that over time you learn how to listen to that, and over time you can trust that that is telling you what you need and how to manage it. Okay, so if you have any forms of movement that aren't exercise that you find really helpful for you and your conditions, comment them below, give people some ideas. This might be gardening, watering your plants, this might be the grocery shop, this might be gentle stretching, this might be sitting on the floor with your child, whatever it may be, but put some comments below, let us know what some ideas are so that we can share them with others, so that we feel like that list is a little bit more expansive. Now, make sure that you are reaching out to your health providers in regards to the safety of movement for you. But again, it is your body being your guide. So make sure that you're working within your health team and within your health capacity. So sending love to you all, and see you soon.